The first order of business at Tantrum Camp for Women was to show the campers just how dangerous all that pent-up anger can be. And I think we made a big impression.
Welcome to Rancho Del Rio Stables with the medical inflatables Mega Hard, Cardiology 101, and there will be a test. I specialize in helping you keep your hearts healthy, preventative cardiology, so you can see me before you have a problem. Being stressed out and feeling anger is not so good for the heart. The blood pressure gets too high, your pulse beats really fast, your heart works so strong and so hard that over time, the arteries will constrict. And not only that, all of these hormones cause the blood in your heart to become very sticky and form clots. So you can have a heart attack, you can have a stroke, so it's very dangerous and we need to break the cycle. We used to treat little old ladies and little old men, and now we're treating, unfortunately, women your age. So we want you to control this anger and the stress so that you can have long and healthy lives. You know you've had ultrasounds and I've been reviewing them all night. Who wants to be first?
I'll go first.
We noticed that your heart rate was a little fast and that your heart was working really hard. To me, that indicates that maybe the stress has been kind of a chronic situation with you, and that if you continue at this stage, your heart may at some point say, I've had enough. I noticed that your heart rate, your pulse, was a little fast. Right now you're young, you're healthy, your heart can continue to do that, but as you get older, it doesn't want to work that hard. What were you doing right before we were doing this ultrasound?
Driving crazy traffic.
It just seems like your heart is beating really strong and really fast and working super hard. So there we see the stress of you being in the car. So when you get angry, we know that your blood pressure tends to rise. We want to really work on bringing your blood pressure down with relaxation techniques and try to avoid medicine, because if you continue at this rate, you're probably going to need to be on medication in the future. I'd like all of you to go back and talk to your doctors about this information and work with them with ways to help reduce the stress and anger especially, so that you can keep your hearts healthy.
Great. Thank you so much.
Thank you so
Really
much.
appreciate it. Bye.
That was cardiologist Dr. Lisa Matzer, and she is here along with our campers. And Dr. Matzer, you're seeing more and more of stress-related heart issues?
I am. I am seeing younger and younger women with heart issues. Almost 50% of my practice now, every day, is a stress-related heart condition.
And ladies, were you surprised to learn that the stress that you're feeling, the anger, is having true physiologic consequences?
I really wasn't even putting that together. And then when, I didn't think there was gonna be any kind of, anything showing in my heart. I thought it was gonna be fine. I thought, I was strong, so I'm gonna be fine. But, to find out that my heart's already working double without me having to actually stress out or get angry, just be normal. It's already working double.
Stress does so many things to your body. Dr. Matzer hit the nail on the head.